So what would you say constitutes a good low-carb diet for weight loss?
Again, as implied, people vary one from another. Some people, the people have diseases or conditions associated with insulin resistance or carbohydrate intolerance, have to get quite low in their carbohydrates. Doesn't mean zero carbs, but when we do it in grams per day, you get into this adapted state. We call it keto adaptation because the body starts making ketones when you get low in carbs, under 50 grams a day. But we know people who are very insulin resistant, patients or colleagues of ours, and again, some of our most interesting patients are fellow physicians who are doing low carb, that they have to be under 25 grams of carbohydrate per day to be on a diet that allows them to get into the sustained fuel flow where fat becomes the body's primary fuel. So for one person, it might be 25 grams a day if they're severely insulin resistant. For a person who's carbohydrate tolerant, then maybe they can eat 100 or so grams of carbohydrate per day, still get the benefits of a modest degree of carbohydrate restriction. So there's no one perfect diet for everyone. It really has to be individualized to allow each person to find that, shouldn't say sweet spot, but I will, sweet spot for them dietarily that lets them feel and function well.
And would you say that could vary with age as people change from their 20s to their 40s to their into the 60s even, that could totally change throughout their life?
I resemble that. I think there was some cat who said that in a cartoon. When I was in my 20s, 30s, 40s, up to my early 50s, I could tolerate vast amounts of carbohydrate and do just fine. When I passed the age 50 threshold, I started gaining weight in the middle, I started gaining blood pressure, and using all the best techniques of, quote, balanced diet, using high fruit and vegetable and low saturated fat and lots of dairy, low fat dairy, all the things that are supposed to control blood pressure. My blood pressure was getting to a point where it was dangerous. And the only way I got my weight and my blood pressure under control was switching to low carb. And I stay under 50 grams per day and have done for close to a decade now. So for me, the diet that served me well in my youth did not serve me well in what I now consider my middle years.
And can you talk mechanistically about how carbohydrate restriction or limiting carbohydrates would help manage blood pressure, for example?
That's a wonderful question. And we're actually working with a nationally recognized nephrologist who's collaborating with us on a current, Jeff and I, on a current study. We do know that in studies done on total fasting in humans, done 50 years ago, that when you put a person on total starvation with no calories coming in at all, the ketone levels in the body get up to...
Before you go on about ketones, to tell people what ketones are, for those who don't know.
Okay.